Now, it appears that there is more than meets the eye in the now controversial health equipment supply project.
It is the unwillingness of the national government to share sufficient information.
It's a new twist to the medical equipment leasing project that
the governors termed the project a fraud and a scandal in the making.
It's a project that has constantly been in the headlines for all the wrong reasons. In 2019, 5 years into the 7-year medical equipment leasing scheme, a lot more has happened, and the mystery surrounding it continues to outweigh its intended goal.
Some counties are ahead of others are really behind. You may find one aspect of healthcare, one sector is doing very well, it has been done very well. And then you go to another place, things are so bad. People who have stayed with their disease for so long, they develop complications, they come when it's very advanced because they could not access the slightest, the lowest level of care and even just a referral facility to where they could get help. Some other places don't have space to put the equipment. You put the equipment, huge equipment, the room you're supposed to fit cannot even fit that equipment because no one did the groundwork to find out where are we going to fit this equipment when we reach this facility.
Capacity building, lack of a needs assessment, and consultation are some of the challenges facing the medical scheme. But these issues are not the only ones failing it.
We are not certain whether the actual payments were done in 2014 or 2015, because it appears the contracts were signed in 2015. The budget was done in 2014, but the contracts were signed much later. But the equipment had already been delivered. So there's a discrepancy in terms of the budget. There's a discrepancy in terms of the signing of the contract, and there's a further discrepancy in terms of the initial payment.
Procurement is a very difficult one. You can't see it because if it is well organized, it's very difficult to see. So the only time you can see is when you jump the fence and see what has been delivered, and that's where you come into the issue of value for money.
Data leaked to Africa Uncensored from the Integrated Financial Management Information System containing over 25,000 payment transactions between the year 2014 and February 2018 revealed that some of these payments were made before the signing of the contracts between the Ministry of Health and the suppliers. The data also indicates that payments to all the suppliers began in 2015 except for the Philips Medical, which began in 2016.
At the time we started this, only Senator Bonnie Anwale and I raised the issue. And I have figures to show that an outright purchase would have cost us something close to 31 billion at the time. So there was a discrepancy of nearly 7 billion shillings at the time of the initial lease.
The total amount paid out to the suppliers by February 2018, according to the IFMIS data in our possession, was over 26 billion shillings. Then, in 2018, the initial annual payment by the counties to the EMEA suppliers of 95 million shillings increased to 200 million shillings per county.
In public finance management terms, increase vary any contract beyond 15%. From 95 to 2 million, 200 million is more than 100%. That is already an illegality.
It's just mystifying to me why the price would suddenly go up so much, especially considering that our budgets don't increase by a similar amount of money to accommodate that increase.
After the 7 contracts were signed in 2015, no further contract has been signed between national government and the contractors. So where did the variation come from? The new corruption is debt. The new corruption in Africa is debts. Entering into debts where there are kickbacks involved. So it's official corruption. So is it possible that in these contracts, which are long-term, long leases, which should not be long leases, should be outright purchase, instead of spending 30 billion or 40 billion, give it 40 billion, we have ended up spending 80. And the money that is the difference is money that has gone to wrong hands, has been misappropriated.
So what then would be the implications for this kind of variation?
There would be no justification at all, but in fact it would be unconstitutional because, you know, our constitution is anchored on very serious ethos of transparency, accountability, yeah, which we must respect. So how do you want somebody to account for something which they really have no control over?
If you vary a contract, if you vary the cost of a contract, there must be reasons for the variation, but it will be a document. The documents that tabled at Senate do not have any variation contracts additional to the original 7 contracts. This issue, this matter will most likely unearth very serious legal violations that have been committed by the mandarins of the Ministry of Health and Treasury to the people of Kenya.
More disturbing is the fact that the contracts that bind the country to this multi-billion shillings project have never been made public to date. None of the Kenya's 47 governors at the time or any of their staff have reported actually reading the contracts between the Ministry of Health and suppliers.
I'm actually shocked. Because if you look at, if I was in the private sector, I would expect the CEO would see any documentation that is signed on behalf of the company. In the same vein, I would have expected that the leadership of the county, both at the level of the governor and his respective CECs, should have been shown and taken through this contract.
This issue has been a matter of concern. The Parliament has been asking for a special audit. And even the donors have been very concerned about the Ministry of Health and the spending there. My last talk, and which I'm still insisting, is for us to have all these contracts given. We haven't had them yet given.
We wrote to the Ministry of Health requesting access to these contracts, but that request remains largely unsuccessful. After a number of letters from the Commission for Administrative Justice, the ministry wrote back in September 2019 stating that it will not give us the contracts because there were other applicants in court asking for the same documents, and that we were a private company and we could not be granted rights under Kenyan access to information laws, in spite of the fact that we wrote to the ministry as Kenyan journalists seeking this information. In 2018, senators summoned the Ministry of Health Cabinet Secretary Cecily Kariuki over the EMES project. It is here that Mutula Jr., a member of the Senate Finance and Budget Committee, would get a glimpse of the mysterious contracts for the first time.
When I had signed the contract, I was surprised that they were signed by the Permanent Secretary in all cases, as opposed to the Cabinet Secretary, who would ideally, under the Constitution, be answerable for his signature to Parliament for them. That struck me as a very strange thing. I'm not even sure whether he signed it on delegated responsibility or he signed on his own motion, but the Cabinet Secretary has not signed all those documents.
As the Ministry of Health continues to deny the public access to these documents, a 2018 Senate interim report, together with the IFMIS data in our possession, point to potentially serious irregularities. Take a look at these 2 examples. The contract between the Government of Kenya and Shenzhen Mindri for the supply of theatre equipment was to commence on 6th May 2015, but the agreement was signed almost 2 years later on 13th March 2017. The commencement date for the contract between the Government of Kenya and the Steam Industries for the supply of theatre CSSD equipment was on 6th February 2015, but the agreement was signed on 20th July 2016. By the time of the signing of these 2 contracts, the suppliers had already received payments amounting to over 2 billion shillings each.
It appears as if that you are robbing Peter to pay Paul, because we are taxing the public so high, but then pretending we are giving them free healthcare. Because when we purchase equipment at such a high cost, twice the cost, they are paying for it. through taxes and other indirect taxes. We are very concerned about some of these issues. And why? Because our debt portfolio is the first charge on our consolidated fund. We are paying debt first, and then the money is then distributed. And hence the reason why you're having cash flow problems even to counties, because the first charge on our revenue is on debt.
If we were paying for this lease in foreign currency, and the foreign currency value changes, then it puts the county at a great disadvantage. Because if the dollar, something happens between the dollar and the shilling, it means that we are going to be spending a lot more shillings as a county to service that kind of debt.
The procurement processes seem to have been breached, transparency questions ignored, and variations of the contracts have gone without valid explanations. With only 2 years remaining before the contract expire, who is to blame for the mess made of the MES?
First, Treasury negotiated these contracts on behalf of the Kenyan people, not behalf of government. They negotiated on behalf of the Kenyan people. They should take the first bullet should be theirs. And the question of the value for money is also theirs. The Ministry of Health had an additional duty. An additional duty for them was on behalf of national government to consult the counties on terms of the need basis before these contracts were signed, and ascertain and ensure that there was prudence and value to the counties.
Lakini hawa watu tunachaguanga wanatupatanga wakati wa kura hadi hapa kwa mlango. Lakini saa hii nimekuwa na sister yangu, naendanga mahali wako siwapati, naenda siwapati. Lakini wakati wa kuomba kura wanakujanga mpaka huko kwa mlango, ama wanakuja mahali fulani tunaitwa. Lakini saa hii niko na mgonjwa kwa nyumba. Hata kwa maofisi zao naenda, naambia siwezi wapata hiyo siku.
The government aims to accomplish the highest possible standard of health for all its citizens. But as far as this goal is concerned, even access to these services remains biased.
While we are taking pride in some of these things, a lot of Kenyans are going out there to receive healthcare in India and other places. But the common person who doesn't have a plot of land, a parcel of land to sell, doesn't have a car to mortgage, doesn't have a pay slip to get a loan, cannot afford even a logbook to go and get medical health care, is suffering.
Kepeda nipone mimi niendelee na kazi yangu. Nizonge machungwa.
Ulikuwa unauza machungwa? Kwa kazi unafanya? Lakini mwenye ako na pesa hakuna mahali hawezi enda. Inamtetea, inamsimamia kila kitu.
We made 2 interview requests to the Cabinet Secretary in charge of health, Ms. Cicely Kariuki, but she told us that she preferred to answer questions put to her by the Senate, thus giving the public a more direct and comprehensive set of answers regarding the MES. While some progress has been made so far with regard to the MES, the vital issues that were overlooked will continue to cost Kenyans even more.
So we are wondering, what is going to happen on the 7th year? On the equipment? Do we in Makueni, who have set up a trauma facility with MRIs and CT scans, are we going to remove them and return them? Because they are leased according to the contract. Or is the government going to say that in fact the lease was a purchase? Or are we going to purchase and lease back?
As a doctor, I'm actually very worried because, when this project started, all of us had high hopes that finally somebody is thinking about funding the public hospitals, and somebody is thinking about the largest majority of Kenyans who only access services at the public hospitals. It's really sad, and it brings in an element of despair as a doctor in a public hospital.
Since we first met, Esther and Gladys have been on a difficult journey from desperation to hope that Esther would finally receive the treatment that she so badly needed. It hasn't always been easy though. In early June, I went to visit Esther at the Kenyatta National Hospital after getting news that her condition hadn't improved. Seeing her didn't give me much hope. Today is the 15th of July 2019. It's about 8:45 a.m. on a Monday, and I just received some very sad news. Gladys Mwihaki, sister to Esther Wambui, has just called me to notify me that yesterday at about 1 p.m. we lost Esther. She passed on at the Kenyatta National Hospital, where she was being treated for cervical cancer. Throughout her battle with cervical cancer, Esther went through a painful and heartbreaking journey in search of medical treatment. She may have fought for her life as much as she could, but even in death, the problems she went through continued to haunt the family she left behind. With a medical bill of about 200,000 shillings, Esther's family could not retrieve her body from Kenyatta National Hospital or prepare for her burial. Africa Uncensored made public the family's situation through an online campaign requesting Kenyans of goodwill to help raise funds for the family. Four weeks later, Esther would finally be laid to rest. It had only been 9 months since Esther, a daughter, sister, mother and friend, was diagnosed with cancer. She was just 33. Could Esther's struggle to access medical care have been avoided? Could she still be alive today had she started the treatment on time? Two kinds of cancer made Esther a victim: the cancer in her body and the cancer that has captured Kenya's healthcare system.